The Togolese government promised to provide clean water to 2/3 of the population by 2015. It is 2012, but the government has only managed to provide 1 in 3 Togolese with clean drinking water. Telu Baubau is 10, lives in Kante. His water comes from uncovered well. This is a danger to his health.
We are currently collecting water to cook and wash the dishes.
You will also drink this water?
Yes.
Don't you get sick when you drink it?
No.
Water is life, but also a source of disease. In the countryside of Togo, they seem to be ignorant. Nabige Kuliyole, son of a tomato farmer, believes that their well, the only one in the locality, will dry up soon and they will have no choice than to go back to the river for water.
We get water to drink from the river.
You don't have wells in the neighborhood?
No. We dug the well this year to grow tomato and raise money. Also, it allows us to pay school fees for children.
Was the well made for farming?
Yes, but we fetch it for drinking and cooking. But before the end of the tomato season, water dries up in the well and we have to use the river water. We know that river water isn't good for our health. We go to the hospital when we get sick or take some traditional herbs for medication.
Drinking unsafe water involves several waterborne diseases, says Dr. David Ikude-Iou, former Minister of Health.
Il y a plusieurs maladies qu'on peut contracter quand on boit de l'eau non potable.
There are a lot of diseases that can be contracted while consuming a non-drinkable water. The worst and deadly is cholera. It comes with dehydration and diarrhea and can lead to the death in a couple of hours. It is one of the predominant dirty hands disease. We also have a typhoid fever that is really frequent in rural and urban areas. It is also a dirty hand disease. Other bacteria can also be contracted in low hygienic conditions and can also lead to death if the water is not well stored. These are the 3 diseases that are extremely serious in short time.
Ce sont des maladies qui sont quand même extrêmement graves sur le plan immédiat.
In the long run, there are also some intestinal parasites like tapeworm. Actually, when you go to any village in the country and conduct stool analysis, you have approximately about 40 to 60% infected.
60% au minimum de gens qui ont des vers.
Officials of the Togolese government argue that they have started efforts with the support of development partners. The rate of people's access to drinking water has doubled in 2 years, according to Nigeria Manako, the Paon Regional Director of Hygiene and Sanitation.
Avant 2009, il y avait d'énormes problèmes en matière d'eau.
Before 2009, there were lots of hygiene, water and sanitation problems. From 2009, efforts are being made and we are striving to eliminate these problems, but we are still far from the Millennium Development Goals. In 2010 to 2011, there were 95 drilling achievements. In 2011, about 90 wells were to be constructed.
Dans les écoles, nous sommes aujourd'hui à 12%.
Regarding drinking water in schools, we have reached 12%. From 2009, the UNICEF took over the education of children issues and it is working on the aim that every child has access to safe drinking water. That brought the indicator of drinking water from 6% to 12% within 3 years.
Il y a encore 5% de la population de la région des savanes.
Also, 65% of the population defecates in open air. As a consequence, diarrhea disease prevails as second leading cause of deaths of children under 5 years, then after malaria.
C'est les maladies diarrhéiques qui prennent le pas.
In Togo, the hope of reaching the target of 65% of the population having access to water as promised is no more realistic. The civil society is calling for a real political will and involvement of all stakeholders. Strongly recommend Agouta Aladju, president of the Togolese Association of Consumers.
Avec des efforts considérables,
with considerable effort, with the willingness and enthusiasm of the population and also the media, we can reach the goals as Togo is trying to resume cooperation with its partners in development aid. There should be a control of all these aids and projects. For example, if 200 wells must be dug in a community, there should be a monitoring and control to see if it is done or if people benefit from it. But if there is funding for 200 boreholes and only 150 or 175 are sunk. There are 25 wells that are missing. There have to be instruments to check whether works required have been done. There should be a visibility in the financing.
Effort from all angles should be put in place at all levels to ensure that this goal is not just a recitation of good intentions. Sylvio Combey and Laura Volonc from Togo.